It's no secret that the cost of your health care and your health insurance are going up. Over the past 30 years, premiums, deductibles, and coinsurance have been increasing while benefits have been decreasing. In 1990, the average cost of a hospital stay to you and me was $700. Today, it's over $10,700. That's a 1,500% increase and doesn't take into account all of the other expenses associated with an accident or catastrophic illness. But how likely are you or someone in your family to end up in the hospital? Well, let's take a look at the numbers. According to the American Heart Association, every 16 seconds in the United States, someone has a coronary event. That's 800,000 strokes and 1.2 million heart attacks each year. According to the American Cancer Society, every 24 seconds, someone in the United States is diagnosed with cancer. 1 in 2 men and 1 in 3 women will develop some form of cancer in their lifetime. Every 60 seconds in the United States, there's an accident that requires an ER visit or hospital stay. That translates to 2 million hospital stays, 30 million ER visits, and an additional 30 million doctor's visits every year due to accidents. But what does all of that mean to you? Well, according to the American Hospital Association, 84% of the time, the reason you go to the hospital is due to an accident. 82% of the time, the reason you stay overnight or longer is due to one of 4 things: an accident, heart attack, stroke, or cancer. Those numbers are important because they help us understand where our real risks are, both health-wise and financially. 2 other bad things happen when we experience a major health event: expenses go up and income goes down. According to a February 11, 2019 CNBC report, over 66% of the bankruptcies in the United States are caused by medical bills, and 2/3 of those people had health insurance. Most families touched by cancer will use up most, if not all, of their life savings and face the future with little or no money left. And the Affordable Care Act has done nothing to change any of this. But what happened to those people? Why wasn't their health insurance enough? To understand the answer to those questions, you have to understand the true financial impact of a catastrophic health event. Start by combining your deductible and coinsurance with the cost of uncovered medical expenses, lost income for you and your spouse, extra child care expenses, and travel costs. Then add to that your mortgage or rent, food, utilities, clothing, and other daily expenses that go on regardless of the state of your health, and you have a recipe for financial disaster. But what if you could have health coverage plus additional coverage for illnesses and accidents for no more money than you're spending now on health insurance alone? These plans pay a lump sum of up to $500,000 directly to you in the event of an illness or accident. And all of that is in addition to having great health insurance to cover the majority of your medical bills. Isn't that a better way to spend your healthcare dollars? Buying more insurance for the same amount of money. Here are some examples of individuals and families who, without spending any extra money, have the added protection of the Total Protection Plan to help them survive a major health event both physically and financially. In every case, their medical bills were paid in full, and they received either a lump sum payment on diagnosis or a regular monthly check to offset lost income while they recovered. But how do you spend less money and have more coverage, you ask? Well, first off, you purchase the most cost-effective health coverage you can. I know it's a crazy thing for an insurance agent to say, but it's the truth. By purchasing a high-deductible, low-premium plan, and then using some of the money you're saving in health insurance premiums to purchase catastrophic coverage along with an accident plan gives you the most coverage for the same dollars spent. More coverage for less money. That's the Total Protection Plan. A combination of health insurance, catastrophic illness, plus accident coverage, all for less than the cost of a low-deductible, high-premium health plan alone. Having a total protection plan designed to fit your unique concerns is as easy as making a phone call. Contact Jerry Bowman today.